We're going to transition now to a panel discussion. And so we'll have some spotlights of all our presenters today and invite them to come back on camera if they're willing. We have a few questions for you. And we'll start with a question that came in the chat. And this one might be for the whole audience and all participants. So we'll just put it out there. And Carrie put this in the chat about the number of new programs coming on to CACFP year after year for states and how you track that participation over time. Any thoughts out there from the states on the call about how you do that, how you understand it and what it looks like?
I'll go ahead and respond to that. So this will be a lot easier for us with the new common identifier in Pennsylvania. Prior to this, that would have been very difficult. That is not data that the Department of Education, I mean, they maintain it, but they're not pulling those types of reports. So these types of reports and briefs are generated by us at the Department of Health through our collaboration and with our evaluation team support. So it is feasible, but if you don't have a common identifier between the two databases, it's just it takes a lot of time to match it up.
Yeah. I can imagine that, because you would have new programs coming on to both CACFP, but also new programs that come into existence as programs shut down. So you've got to figure out what that looks like. And that common identifier really simplifies that already.
Yeah. Yes, and I will say in our data brief, we did look at the number or percentage of consistent centers. So which centers participated across all 3 years in our most recent brief. So we were able to look at the consistent number. And I want to say, I don't have it off the top of, I want to say it was maybe 74 or 76% over that 3-year period were consistent participants in CACFP.
Thanks, Tiffany. Are there other states on the call that want to contribute anything? I think there was also what is a reasonable number to increase year after year? Posted in the chat.
I'll just speak up for Vermont. I think what makes these questions really hard to answer is the very shifting nature of the early childhood system right now. I see lots of nods. Programs opening, programs closing, are there stabilization funds? What's going to be funded? So to Alex's point very early on, we unfortunately have been looking at this kind of like point in time, and then looking at that point in time data as a trend over time, but it hasn't been apples to apples. So how useful that data ultimately is to our efforts is questionable, to be quite honest.
Thanks, Cynthia.
I can jump off of that. I think that's kind of the elephant in the room. With every presentation, with every conversation that we have with states, we have this talk about data sustainability and updating and keeping it fresh. And I think that the pandemic really highlighted for everybody here, I'm definitely preaching to the choir about the data change, the landscape of not only CACFP, but early care and education can change so quickly from month to month, not just year over year. And so when we're talking about, when a strategy for change is investing in data systems to keep these data linked, this is why, because we want to be able to look at changes over time, and we want to be able to look not just at a point in time and have tools for advocacy where you can show your legislator, hey, this is what's going on right now, as opposed to this is what it was in 2022. Or for your administrative use, you can look in real time to look and see where expansion efforts are. So we definitely, this is why you're seeing with a lot of these questions.
Yeah, I'll also add, we looked at it in context of counties with 12% or higher food insecurity rates. And unfortunately, through the pandemic, we saw pretty significant reduction in those counties, which is unfortunate. But I think that those kinds of that kind of data can be really powerful when speaking with policymakers and leadership.
Thanks, Tiffany. Alex, this next question is for you or Jasmine, I believe. And there was a question about the timeline from the beginning to the end of the creation of a GIS map.
The timeline for the GIS map, one thing we definitely like to tell folks early on is that it's a collaborative process. We do like to bake in a lot of review cycles, which can also make the timeline a lot longer. But we, I think Alex might have touched on this a bit. We like to first make sure that the data is accurate. Creating that that scratch map, that takes some time for that review process, and then creating the map dashboard for the aesthetic review, that takes some time, and then developing the story map text, making sure that I think also that we're noticing, making sure that the state approves the message and that the language is accurate. So again, another review process that sometimes may take a couple weeks just for the state, just to make sure that it's approved. And then we finalize it all on the online version. So by that time, hopefully it's minimal revisions for that. And again, another review cycle from the states. And then we give, that data back to you, and as well as the link. And Alex, did I miss anything?
Yeah, that's a nice overview of our process. And we usually take, because there's some work up front that Nemours has to do with their tap and span states to get the cohort set. And so we usually run from January to July. But that's pretty fast. It's usually pretty breakneck speed that we're going at to try to get multiple states done, because our team is this three. We have Claire Waterman, who's our senior director of research, who oversees these operations, but really we're the three people who have generated all the content for the last 2-3 years. So with other priorities and projects that we work on, I say January to July with a bit of an asterisk, that we ideally, if we're thinking about sustainability and states taking this on, I would plan for more than just that amount of time to try to really allow yourself the space to explore your data, to understand it. Every state is different, so we try to take some time to get into the data and figure out what's going on. So if you're thinking, if any states out here thinking about trying to develop their own program, take some time, I'd say a year or so at a minimum, to really get familiar with it, do the merging correctly, and set up whatever structure that works well for you and your goals.
Next question's for Diane. Thanks, Alex, for that. And as you have worked with states around the strategies, is there any strategy that really bubbles up for you as the most impactful to increase participation?
Money, not to be flippant, but just thinking about what's going to make the biggest changes. At the end of the day, it's going to be increased funding coming from the federal level and an overhaul of CACFP, again, at the federal level, to improve the program. But I mean, we know this isn't easy, and it's like, okay, then how do we get there, especially when we don't really have access to those changes at the moment. And I think it's starting with, we saw this so frequently brought up by the states, is building partnerships across the spectrum of food, nutrition, and childcare and early learning, and being able to share the data, share the examples, hold those listening sessions, bring the different groups together, align your recommendations and your messaging so that you can eventually make change. I think data is really key to to successful advocacy campaigns, and change is really slow, and there's a lot of priorities before Congress right now, and it's divided. So it's gonna be a tough time to really get anything done, but it's like making these relationships as a first step, I think, and using these maps to build those relationships, then also start targeting at the very local level, providers to come on board and learn what the challenges are. The most effective, I think, probably the strongest strategies that we've heard come out of this.
I love the spotlights on the maps for that, because I do think that they really motivate communities to see what's happening at the grassroots level. And even though you can't do every community, once you see it, you can make your own spotlight once you've understood how to do it. And so it's really a universal tool. But I think that, and it's come up multiple times from almost everybody today, activating that grassroots, that community level interest, and how can we improve nutrition security in our communities. Since we're not getting supports from the state, or we don't have the funding to get the supports from the state, we do have to go back to that grassroots, and how can we make it happen there? Thanks. I guess one other question for the states on the call to wrap up, if they have any reflections or from the mapping process that you'd like to share with others on the call. We do have over 21 maps we've done. We have multiple states that are on the call, and love to hear from them.
I'll jump in. So I think that just a couple of things, if you're interested in doing this work, is to garner an understanding of who houses this data in your state and the processes to obtain it. Because I will say the first go around, I learned a lot with that process and the formal requests that were needed, using common terminology. I will say just between 2019 and updating our map this year, Child Care Aware has built in wonderful resources and tools to really help with that. So creating, structured formats and the types of data that they need to complete the map. Those tools have been really helpful. So, there's a lot of guidance and support through that process. And then, I think, like I had mentioned before, there's just keep in mind, while it might be a heavy lift, there's some other good uses for the data once you've done the work. So I think those are the challenges that I would highlight. And then, utilizing your partners to really create a dissemination plan. And I'm really looking forward to the new kind of training and technical assistance from Child Care Aware on that piece. And that's something, like I mentioned during my presentation, that partners were really looking for last time around. So I think that'll be really helpful to propel this forward.
Thanks, Tiffany. Agree. Any other state that would like to share their map process, concerns, lessons learned?
I'll just add that, and Alex mentioned this in their quality assurance checklist, but really having a core group of folks, including those community level people who can review your data at multiple times, and making sure that they know what they're in for, and can commit to that process. It's really helpful to have those multiple sets of eyes on data, because everybody in my group caught something along the way that I never would have seen, in either by myself or with one or two people. So I think that core group is really critical to that data cleaning process.
Rebecca, I can also share, I'm not sure if Misty Pearson is still on the call, but South Carolina actually developed their own GIS maps in partnership with the University of South Carolina. And I think the concern there was, being able to update the maps on a regular basis. This actually speaks to a lot of what Tiffany mentioned, because there was that prior relationship. So the South Carolina Department of Social Services, their ECE division, had an existing relationship with the USC. And they were able to get that data directly to USC for them to develop those maps. they produced, well, they were released last year. So at the time they were working on them around 2021, they used data as of 2020. And then following the maps that similar to child care, where their approach, they also mapped out, food deserts and pockets of poverty. And following the release of the maps, they conducted focus groups. So to follow up with some of the providers that were not participating and to hear about, what were some of the barriers and challenges to their participation. They heard things like, the paperwork, reimbursement process, parents' income information and disclosures there. So they were able to really get some helpful information that could help them with their strategy around CACFP promotion in the state.
Thanks, Georgie. It's really exciting to think about states being able to do this and update them periodically, because it is a costly process to create the map, and having that internal resource would really be great for you as you advocate to increase participation. Are there other questions for our panel? We have about 60 seconds.
I added a question in the chat. It says, so I know that reimbursement rates for individual providers is not enough to pay for food costs, but we have seen some models piloting group purchasing for multiple sites may be more cost effective. Do you have any comments in regards to these models moving forward?
I will just add quickly that that is one of the strategies moving forward. Our Vermont Agency of Agriculture actually just awarded a small vision grant, it's called, to our network, Farm to School and Early Childhood Network, to actually pilot community-driven meal service and or food procurement processes. So again, we're going to use the map to determine what programs we want to reach out to. And then they will help determine what those pilots will look like. So more to come on that, but that is one of the outcomes from this work. We're excited to see what happens.
Thanks, Cynthia. And thanks to all our panelists and presenters today. It was really a rich discussion, and I learned so much. I think I have about 4 pages of notes, so thank you so much. Well, this is concluding day 2 of our convening, but before we log off, I would like to turn it over to Roshelle Payes, our great project director, for her closing comments.
Great, thank you. First of all, just wanted to thank all of our participants, from our presenters and our participants. Again, we had another robust afternoon of discussion and learning, and some of the themes that I think we all heard throughout today was how these maps really relied on partnerships, both in developing them and getting the data, having the conversations and getting consensus around the maps and the strategies for change, but that the maps, once they were completed, also led to new partnerships. So I thought that was really great to hear. Data, data, data. I wrote down data so many times throughout the day. And I think that's important. It's critical for this work. It's critical for raising awareness and also understanding our progress in increasing CACFP participation. So I know that we all recognize there's continued need for more. And also a lot of discussion around sustainability. These maps can be a snapshot in time, but it's really important, as we heard from the states, how they've used the maps, but also how they can continue to build on those maps, update those maps to inform this work moving forward. So again, I want to thank everyone for joining us this afternoon. I also want to give a huge shout out to Caliste and Hannah, who spearheaded these 2-day convenings. We could not have done it without their leadership. We had amazing behind the scenes and organization, a whole run of show. So I really appreciate all their effort, and a huge thank you to the entire ECE team at Nemours, and thank you to CDC as well for joining us and providing guidance to us throughout this work and in the convening planning. Again, we will share everything out through the website, through communications in the next couple of days. You know, if you have lingering questions and want to be connected with any of the presenters, please feel free to reach out to us and we can help make those connections to support your continued learning. Again, please check out the chat. There's a link for an evaluation, will help us inform future convenings or webinars. So thank you. Khaleesi, anything else? All right.
We're good to go.
Excellent. Enjoy the rest of your afternoon and thank you again for joining us.